Thank you for staying tuned to Channels Television. A warm welcome to yet another edition of Health Matters. I'm Joke Rogers. Alzheimer's disease is a type of dementia that affects memory, thinking, and behavior. It's a progressive mental deterioration that occurs in the middle age or old age due to generalized degeneration of the brain. Now, in Nigeria, the prevalence and cases of Alzheimer's have increased over the last 2 decades. Our focus today is on this condition that's often misunderstood, but increasingly affecting families worldwide. On the program today, we will be joined by Dr. Nkechi Obanose, a consultant neurologist at the University of Abuja Teaching Hospital, who will help us understand the disease and how we can better support those living with it. Don't forget, you're also an integral part of this program. When it's that time, you can join us via the telephone on 080-8054-2233. Do stay with us on Health Matters. Welcome back. I'm now being joined on the program to take a look at this condition by consultant neurologist at the University of Abuja Teaching Hospital, Dr. Nkechi Obanose, who joins us from our Abuja studios. A warm welcome to the program today.
Thank you for having me.
Right, so what exactly is Alzheimer's disease, and how is this different from any other that affects that's different from the normal age-related health issues that we usually see as people get older?
Okay, Alzheimer's disease is actually just one of the different types of dementia. So it's actually a form of dementia in which there's like a progressive decline in memory or other cognitive functions. So it's a lot of times people only attribute, problems with memory and with Alzheimer's, but sometimes you have other issues of cognition like executive function, planning, things that have to do with visual spatial orientation, and judgment, social cognition, being able to know how to behave in particular environments. So all these are different cognitive domains, although memory tends to be the most prominent symptom, memory problems. So when you have a progressive decline in memory and it's associated with certain pathological changes within the brain, then you now subclassify it and say this is an Alzheimer's type of dementia. So under dementia, which is a broad category of, all the different types of cognitive decline, Alzheimer's is a specific and the commonest type of dementia worldwide as well as in Nigeria.
Right.
So dementia...
Go ahead.
So dementia actually is when you have not just the progression in cognitive decline, but when it begins to affect your activities of daily living. So either difficulties with toileting, difficulties with dressing, difficulties just going about your normal day-to-day activities, planning, difficulties with your environments at work, going to the bank, cooking. Those are all what you do on a day-to-day basis that you kind of take for granted. So by the time you begin to see, those affectations of activities of daily living, you now call that a dementia. And then if it fits a certain category, you now subclassify it as a neurologist as an Alzheimer's disease. Right.
And, people usually associate this with old age, maybe from 50 or 60, in the aged parents and all that. But how is it really, the age relations to Alzheimer's, is it really from old age, or can it happen or occur at any point in life?
Yes, dementia can happen. We have young onset or early onset dementia. It's just that age is definitely a risk factor, so it's commoner as you get older. But you have about 9 to 10% of dementias occur in people who are less than 50 from all the population studies that have been done worldwide. So that also is, something to think about. Those tend to be also more of the familial types that, have a very more of a stronger genetic link. But age is definitely a risk factor. So if the older you get, the higher the chances of having Alzheimer's disease or another type of dementia, but it definitely can occur in people who are much younger.
And what are the early warning signs families should not ignore?
If you have noticed that your relative or any loved one around you is struggling really with memory to the point where you find them maybe forgetting to take their medications in the morning, maybe they go to prepare a dish to, and normally they're quite attentive in the kitchen, and then maybe they forget the thing on the stove and it burns, or they can't remember the PIN of their phone, or they become a bit confused about their account numbers. You begin to wonder, or you see them a bit confused about the names of their children or the names of their friends, or they see a friend that they ought to recognize, and you see them really struggling. Then these are the things that people might just look away, say, oh, mommy or daddy is getting old. But actually, because this is affecting their daily life, they're not able to function, then this should be brought to the attention of their healthcare provider.
And
I also wanted to mention one key thing, though. Sometimes people with dementia also present with behavioral issues. So if you notice mommy is just a little bit more agitated, not sleeping, having this reversed sleep pattern, sleeping more in the daytime, getting kind of aggressive, mommy that is normally a little bit, very happy to see you, she becomes very anxious and irritable. Those are like little clues that you should maybe perhaps look into the fact that she may also be forgetting things.
Right. How is Alzheimer's diagnosed? Are there specific tests or scans available? Or is it just to, look at the person and ask questions and know that, oh, this is the possibility of that this person is suffering from this condition?
Well, first of all, they need to present to the healthcare provider, and usually we have like screening tools we use, and most of them are clinical based. So we have we have different screening tools like the mini mental state exam, the MOCA, the IDEA. We have some that have actually been adapted locally to suit our own environment. So when we talk about screening tools, we talk about things that have been validated that we use to be able to say that this is what you should know. And then if you are not passing the test by not answering the questions up to a certain number, then we can, reasonably conclude that you do have a problem with your cognition, not just with memory, but it assesses many different aspects of cognition. So apart from taking a history from the person and from their loved ones, because a lot of times the people don't really have a good idea of how well they are doing on a day-to-day basis. The history should involve the person who actually lives with the elderly or with the person of concern, and then you now do your screening tools. Your screening tools are validated tools, as I mentioned, that we use in the clinic. And then sometimes and oftentimes we like to do imaging, and imaging most times would involve like an MRI scan of the brain, and where if we see certain kinds of shrinkages within the brain that are not normal for your age, then we can reasonably say that this patient has likely Alzheimer's disease. There are additional diagnostic tests, some of which are not really readily available within Nigeria, and many on an investigational basis. So we can actually take a sample of your blood or of your spinal fluid and go and test it for certain proteins that are deposited in the brain and that seep out into the CSF and into the blood. So we can do these tests, and they check the ratio of that protein. We call them beta amyloid 42:40 ratio. We can also check for tau in the blood and in the CSF. That's the spinal fluid. And if those levels are high, we can also reasonably conclude that not just is this a dementia or a cognitive decline, but that it fits the spectrum of Alzheimer's disease.
And is there any known cause or risk factor that makes someone more likely to develop this condition?
Oh, there are many risk factors so the Lancet Commission issued like a guideline statement in 2024 where they identified risk factors for dementia. So we have what we call the modifiable, the non-modifiable. So there's nothing you can do about your increasing age. The older you get, the more likely you are to develop a neurodegenerative disease, of which Alzheimer's disease is one of them. Of course, women too are more inclined to have dementia, as well as people who have certain genetic phenotypes. So we call it the ApoE epsilon 4, which is like a gene mutation in a transport protein that carries cholesterol in the blood. So if you have the mutation in that gene, and in that, it also predisposes you more to Alzheimer's disease. And it's also been linked with other there's a very small percentage, 1%, that have this link with another gene we call the presenilin 1 and presenilin 2 gene, as well as people who have Down syndrome, trisomy 21. They too have an increased risk of dementia. But what is also very, very striking is that about half of the risk factors for Alzheimer's are actually modifiable. So you can actually reduce your chances of having Alzheimer's disease by just following through about 14 identified risk factors. And they range from 1, education. So the more educated you are, and the higher your level of education, the more you're sort of like immune to dementia. And then other things like hypertension, diabetes, obesity, and high cholesterol levels have been linked to dementia, as well as even things like social isolation. So when you live a sedentary and socially isolated life where you're very lonely, you don't spend a lot of, you don't go out for social activities, those are all risk factors. Other risk factors include hearing loss. So hearing is very important for the brain in terms of cognition, and it has been found that just by putting a hearing aid on people who had some hearing challenges, you could actually help to mitigate their risk of dementia. Visual loss is another one, as well as things like air pollution. So obesity, as we mentioned, and then some other modifiable risk factors. So these were identified by the Lancet Commission, and this is actually what really we should focus on. We do have a way of modifying our risks of having dementia if we're able to tackle these modifiable risks, because there's nothing we can do about the genes we're born with or our age.
Right, and what treatment options exist today? Are they aimed at curing, slowing, or just managing symptoms?
I would like to say that there are many treatment options, because there's hope for everybody with dementia, because dementia, it does not mean that you are not valued anymore. Because there are options available. There have been medications that have actually been shown to slow down the rate of progression of the disease, and they've been in existence for quite a while, and they are the cholinesterase inhibitors. So we have donepezil, we have memantine. So those have been found to be helpful and to slow the rate of progression, and they also improve the symptoms. When you do head-to-head studies in clinical trials, they found that people who were on the medication, they did not decline as fast as those who were not on the medication. You also have other things like the newer therapies. So we have these like monoclonal antibodies. Alzheimer's disease is associated with a protein deposition within the brain they call amyloid beta. So they have these antibodies that go there and kind of like mop up the amyloid beta from the brain. And they are like the new thing now in dementia. And it was really, really promising as the clinical trials were ongoing. We were really hopeful. And we have kind of had our hope a little bit dampened because the results were not as robust as we hoped they would be. But they did reduce clinical decline by about 30% in patients who had a very mild form of dementia. So it hasn't really been tried on those who had like moderate or severe forms of Alzheimer's disease. So for those who have mild cognitive impairment or just mild forms of dementia, the monoclonal antibodies are a new treatment which are available in some research settings in the US and in Europe. And we're hoping that one day, maybe very soon, they will also be available for us here in Africa.
Right. So what kind of support systems are available or should be available for people with this condition?
They definitely need a lot of family support, number one, and community and peer support. So what happens is that a lot of times people begin to feel that with dementia that maybe we've seen a lot of stories in the media of either somebody who got lost wandering into another person's compound and they thought the person was a witch and then they lynched them. And we have similar stories. I had a patient who now described to me that because he had some cognitive challenges, he was struggling with Alzheimer's disease, he was in his compound and then the apartment he was quarreling with one of the people who live in the apartment complex. Unfortunately, they don't really understand that he has this issue of Alzheimer's disease, and there are some behavioral issues that come with it. So he can tend to be unreasonable, and his family members were not around. He got into this altercation with this young man, and then they started beating him up. So they beat him and beat him and beat him until his family came and rescued him. And they were telling him, he's telling the people in the compound, he's not well, he's not well. So these are the kind of shows that we need, like what you're doing now, to educate people that sometimes when people behave abnormally, when they are forgetting things, they have actually a condition. So we need community support, people to be able to understand that this is a neurological disease, this is a disease that can happen to anybody, and to be able to support them in the community. We also need to have family support. What we have seen now is that patients who have good family support tend to do much better than those who do not. So a family where the grandpa is there, the parent is there, the children is there, that social interaction, which has been proven to be one of the protective mechanisms to prevent dementia, is also one of the ways to manage the disease, because the parents always do well in such situations. They are stimulated, mentally and socially. They become happier, and then they also feel like their voice still matters, that they're still important. So we need family support, community support. We need also for governments to also be able to institute health policies where people at the primary healthcare level can be able to identify patients with memory problems and cognitive problems, and be able to refer them early to the tertiary health center where they can get the help that they need. So we need early diagnosis and treatment. We need also support so that there's universal health coverage for all our patients with Alzheimer's disease and other forms of dementia.
Right, and how widespread, is dementia or Alzheimer's in Nigeria?
Well, from our own estimates, from the systematic reviews that we've done, we've seen about like a 5%, but it varies from place to place. So some places you got like 2% to 20%, but on an average about 5% of the population, that's what we have as our prevalence. So if we estimate that we have about 220 million people in Nigeria, and about 5% of them are above the age of 60. So that's what the prevalence is in that age group. So we estimate that there should be about 500,000 people, 500,000 people now currently living with dementia within Nigeria. However, only about 9 out of 10 of them have been diagnosed, because it has been proven that in low and middle income countries that the diagnosis of dementia, the rates are very low. Even in advanced countries, just, your belly, 75% of them are undiagnosed. So even though we have such a high burden, we have a very low rate of diagnosis.
Right. Thank you so much for your contribution and for your time on the program. It's been such an educating moment I'm sure for me and for everybody else that has been listening to you. A pleasure again having you. I've been speaking with Dr. Nkechi Obianozie, consultant neurologist at the University of Abuja Teaching Hospital. Well, moving on, it's cheering news for HIV prevention as the federal government, through the National Agency for the Control of AIDS, joins global leaders on the sidelines of the United Nations General Assembly in New York to announce a historic price reduction for a revolutionary HIV prevention drug, lenacapavir. The landmark agreement unveiled at the Clinton Global Initiative 2025 annual meeting reduces the cost of the twice-yearly HIV prevention injection from $28,000 to just $40 per person per year. This development will make the medicine accessible to millions of Nigerians. We have more on this and other stories on our health news segment.
The Lagos State Government, in collaboration with the Federal Ministry of Health through the National AIDS and STIs Control Program and international partners, have launched the Nigeria State-Level Antiretroviral Therapy Impact Survey in Lagos. The Permanent Secretary of the Lagos State Ministry of Health, Dr. Olusegun Ogboye, says the community-based survey program seeks to estimate HIV treatment coverage and viral load suppression amongst adults and will commence by October until December 2025.
I'd like to also ask the field workers that have been recruited for this work to please take the task extremely seriously. The information that we draw from the results that you give us are going to be used for planning at the ministry and also at national level. And it's important that it's as accurate as possible.
And experts in the health sector have identified lack of obstetrics and gynecological care for pregnant women as the leading cause of over 1,000 maternal and child mortality cases out of every 100,000 deliveries. The former Chief Medical Director of the Federal University of Health Sciences Teaching Hospital, Otukpo, Professor Silas Ojojile, made this known at the Maternal Mortality Reduction Innovation Initiatives organized by the Federal Ministry of Health in collaboration with the Benue State Government. Professor Ojojile was speaking at the week-long workshop where 172 local governments with high mortality rates have been selected for implementation across the country.
What determines whether the women will survive or not is prompt quality emergency obstetric care. The complications kill very fast. So from the onset they appear, what we call danger signs, to when the women die is a factor of how prompt the intervention is gotten. Postpartum hemorrhage, which is bleeding after childbirth, takes an average of 2 hours to kill. Bleeding in pregnancy that is more than 8 months, that is what we call abruptio placentae. Premature separation of a normally situated placenta takes an average of 12 hours to kill.
And the World Health Organization has revealed that the uncontrolled high blood pressure puts over 1 billion people at risk. The WHO, in its second global hypertension report, shows that 1.4 billion people lived with hypertension in 2024, yet just over 1 in 5 have it under control, either through medication or addressing modifiable health risks. The new report also revealed that only 28% of low-income countries have all WHO-recommended hypertension medicines generally available in pharmacies or primary healthcare facilities. Hypertension is a leading cause of heart attack, stroke, chronic kidney disease, and dementia. It is both preventable and treatable, but without urgent action, the WHO says millions of people will continue to die prematurely and countries will face mounting economic losses.
Well, that's our show today, but as we close Health Matters, Alzheimer's may take away memories, but it doesn't take away dignity, humanity, or the need for care and love. By learning more, we can reduce stigma and support those who need us the most. That's Health Matters for this week. Thank you for watching. I'm Joke Rogers. Until next time, stay informed and stay healthy.